everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Metronidazole. Its brand name is Flagyl. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So metronidazole induces its action by inhibiting DNA synthesis. This causes degradation and ultimately bacterial death. In terms of indications for use, metronidazole is indicated to be used as an adjunct therapy in the treatment of infections of the bone. We can see this medication used to treat bacterial meningitis as well as rosacea. It can be used as an adjunct therapy to treat infectious disorders of the joint. And there's also some other indications where this medication would be used as well. Now before somebody was to use metronidazole, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. Alcohol is not to be used with metronidazole, and it also cannot be used 3 days after discontinuing metronidazole. This medication would also be contraindicated in patients who have used disulfiram in the previous 2 weeks. If a patient had a hypersensitivity to metronidazole or any other component of the product, they would not be able to use this medication. And it also should not be used in the first trimester of pregnancy in patients who are using the medication to treat trichomoniasis. Now in terms of precautions, it should be noted that aseptic meningitis has been reported with the use of this medication. If there's any neurological abnormal signs, then the benefit should be weighed against the risk of continuing therapy with metronidazole. In some situations, prompt discontinuation of metronidazole may be necessary. Patients should be monitored for mild leukopenia after administration of metronidazole because this has been reported. Conjunctivitis has been reported when patients use the metronidazole topical cream applied to the face. Patients who are predisposed to edema or swelling should use the injection formulation cautiously as it may result in sodium retention. A dose adjustment is recommended in patients who have severe hepatic or liver disease, and the extended release tablets would not be recommended in these same patients. Closer monitoring is recommended in patients who have renal disease or end-stage renal disease. Seizures and convulsions have been reported, so again, if there's any abnormal neurological signs, the benefit should be weighed against the risk of continuing therapy, and in some cases the medication would have to be discontinued. Local skin reactions have been reported when patients are using the topical cream. In some cases it may be fine to simply use the medication less frequently in this area, however sometimes the medication may have to be discontinued. Now once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use metronidazole, they can expect to receive their dose in many different dosage forms, and the dose that they're going to use would be specific to what they're using it to treat. If somebody is using metronidazole to treat bacterial meningitis, they would typically start off with a loading dose of 15 milligrams per kilogram given intravenously over 1 hour. They would then use 7.5 milligrams per kilogram intravenously every 6 hours, starting 6 hours after the loading dose. The maximum dose would be 4 grams per day. The duration of therapy in this situation would typically be 7 to 10 days. If somebody is using the oral tablets to treat trichomoniasis, they may use 250 milligrams 3 times daily for 7 days. Alternatively, they could use 2 grams as a single dose, or 1 gram broken up into 2 doses taken throughout the same day. If somebody is using the oral capsules, they may use 375 milligrams twice daily for 7 days. Now, as with all medication, there are some side effects or adverse reactions that patients may experience while using metronidazole or Flagyl, so I'll go over some of those here now. 4 to 7% of patients may experience abdominal discomfort. 2 to 9% may experience an abnormal taste in the mouth. Diarrhea can happen up to 4% of the time, and nausea may happen up to 10% of the time. 4% may experience dizziness, and up to 16% may experience a headache if using the oral tablets. Some patients may experience a yeast infection or vaginal discharge, and some patients may also experience vaginal irritation or vaginitis. Now, some more rare but serious side effects would be dermatological reactions such as Stevens-Johnson syndrome or toxic epidermal necrolysis, leukopenia may occur, aseptic meningitis, or ototoxicity. That's all we're going to talk about today with metronidazole or Flagyl. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.